the internet here. In progress. The internet will hold up this time. The last time Sarah spoke last year, I think she might have said penile tumescence or something like that, and the screen froze right in the middle of that phrase. So it was an awkward moment for just a second. So, Sarah, do you mind introducing yourself a little bit and to our audience here? We want to go ahead and let you get started. We appreciate you being a speaker for us again this year, and we hate that you weren't able to travel to be with us, but we look forward to hearing what you have to tell us about sleep and cannabis.
Oh, thanks so much for having me. Oh, yes. Hi there. My name is Sarah Moe, and I am the CEO of Sleep Health Specialists. I became an RPSGT in 2008. Worked overnights for many years. Absolutely loved that time working with my patients. After that, I became an adjunct professor at Minneapolis College, where I taught the sleep medicine program. And now I started my small business in 2015. And I cannot agree with the last speaker enough. There are so many really cool ways to work in sleep medicine. I currently focus on corporate sleep education. I work with companies to teach classes on sleep, but that foundation as an RPSGT really does set you up to be able to do anything. So it'll be exciting to see what you guys choose to do with that. So today we are going to talk about the wacky tobacco. I'm just kidding. It's called cannabis. Sleep and cannabis really has been an interesting conversation in these last few years. So one of the biggest things that we've seen is almost this comparison to melatonin. It's kind of the new wonder drug that people are talking about as far as, can this help me sleep? And really what our job is to do is to help our patients, to help our clients, to help our communities feel better. And if this is a tool that can be utilized, it absolutely should be a part of the conversation. Now, currently, the legalization of marijuana is a huge conversation because it's happening throughout the country. This is a map of where this has been legalized as of April 2023, this year. But even this is outdated. I am currently in Minnesota, and just 2 months ago, they legalized it for recreational use in my state as well. So it really is a big conversation. But currently, there are 24 states in the United States that are fully legalized for recreational and medicinal marijuana use, 15 that are still just medical, and 12 where it is just completely illegal. Now, that being said, even the states where it is fully legal, it is still a federal crime. So if you get caught in one of the legal or illegal states smoking, you can still be charged federally for that. It hasn't happened yet, but it is a possibility. Also, that means that you are not able to legally travel between states with marijuana. But again, this is an important part of the conversation because our patients are asking, CBD oil, marijuana, if I smoke, if I take this, will it help me sleep? And it really is something that can be helpful. Now, for those of us who are familiar with it, this is not a judgmental conversation or a non-judgmental conversation. Everybody has either tried it or knows somebody who has. But for those of you who aren't super familiar with it, it is kind of confusing because we hear a lot of terms being thrown around constantly. And it's like, what does that even mean? So to start, the term cannabis really is what we're looking at when we come to this conclusion of what can be helpful for our sleep. And cannabis is a plant. Cannabis is the plant Cannabis sativa. And from that, there is a derivative called CBD or cannabis oil. And this is the thing that is a big part of the conversation for helping people sleep. Now, from there, with this cannabis plant, we can have either marijuana or hemp. It turns out 33% of the population think these two things are the same, but they actually are very different. Marijuana contains both THC and CBD, CBD being that cannabis oil, but tetrahydrocannabinol is THC, and this is something that contains a psychoactive effect, or this is the part that makes people feel high. Hemp conversely, only contains the CBD. It does, of course, have trace amounts, but it is less than 0.3% of THC that is grown in that specific plant. So with that difference, the main one being obviously with marijuana, you're going to feel high, and with hemp, you'll just get the benefits of the CBD. Now, how does this work within our body? Why does ingesting CBD even enter the conversation? Well, it is helpful because we actually produce this on our own as well. We have what's called an endocannabinoid system, our ECS, and it is a complex neurochemical network that regulates emotions, pain, and sleep. Now, our body naturally releases these endocannabinoid molecules, but when we consume external sources like CBD, it can negatively or positively impact that ECS system. And this is in our hypothalamus. This is where the system receptors work, and this is how we control our circadian rhythms. So it really is interesting to see how this use of CBD oil can be very, very impactful for a lot of bodies. Its research is showing recently that it's more positively impactful than negatively, but there are a lot of different ways that it can be impactful. Now, when people take CBD, there are a lot of different ways they can consume it. And when our patients are coming in, they're saying, okay, my neighbor said that they did this and I want to try that. There are a lot of options out there. So it's really kind of good to differentiate. And when we're having these conversations with our patients, seeing what it is that they are doing to attempt to consume this. About 5% of the population is consuming CBD oil or tinctures. Now, there is a difference between CBD oil and tinctures. Tinctures actually have that CBD soaked in alcohol. So it's very different than just the pure derivative of CBD oil coming from the plant. Now we're seeing almost 2% of the population consuming it in drinks. I'm not sure if you guys have seen these in your state, but I've seen them popping up all over Minnesota recently, where you can just go to your local co-op and they have big coolers full of these drinks that are seltzer waters that contain THC, that they contain CBD, and you can just purchase them anywhere. I will say I did try one a few weeks ago and I ended up watching musicals all night. So take that for whatever it's worth. Next, we've got vaporizers or vapes. This is another place to put CBD oil and people are able to ingest it. And we have topical creams. This is usually used more medically. We can get that put into lotions, shampoos, different things that we can put onto our body and absorb through our skin, our largest organ. Next, we also have capsules. People can just have their CBD oil pressed into a pill to consume at night. Edibles, this is another huge industry that's kind of sweeping through the nation at this point. I know that, we all used to do our different traveling to our national sleep events. And a lot of times when we would go to Denver, I remember everybody saying, oh, great, we can go to the dispensary. But again, now with it being legalized everywhere, these really are popping up. And last but not least is smoking. Most people, 46%, choose to consume via smoke. So why are our patients doing this? Because it can be helpful in a lot of different ways. But the first one is that it is helping a lot with insomnia. And this works a really fascinating way because CBD helps people with insomnia by regulating the hypothalamus and that whole stress hormone. So most times insomnia results from an overactive stress reaction that's spilling over into our rest time. And CBD can suppress this dysregulated stress hormone, and all that overactivation gets equalized. Our sleep-wake cycle can get equalized, counteracting those hormones with the consumption of CBD. Next, we have anxiety. And while most research is still new and we do need more research, it's linked to CBD reduction in anxiety because it's able to calm intrusive thoughts before we lay down without having that lethargy that's associated with THC. So people are seeing huge results in reduced anxiety just from taking CBD oil. Next, we've got restless leg syndrome. And as we know, RLS is actually a neurological condition. But again, this early research is showing that CBD can reduce the frequency of abnormal firings that lead to those involuntary muscle twitches. This could be an absolute game changer for our patients with RLS. Next, circadian rhythm disorders. CBD has been shown to regulate these, improving the quality and quantity of sleep by ensuring the body progresses through normal stages of sleep without disruption. This has been huge in the medical community and in the shift work community recently. Most of the research with this is being done on shift workers, showing how difficult it is for them to maintain consolidated sleep during the day. But with CBD oil use, they're able to sleep those 7 hours on that opposite circadian rhythm schedule in order to maintain higher quality sleep. That's wonderful. And last, chronic pain. Again, early studies are showing promising pain relief potential with patients reporting reduced pain, swelling, and inflammation. Now, obviously, it's not all wonderful. There are going to be risks. One of the main ones is that we can see an increase in the liver enzymes in patients that are taking certain medications that are being metabolized by the liver. Those medications include statins, anti-inflammatories, including ibuprofen and naproxen, certain antihypertensive medications, and blood thinners. Now, another risk is lack of regulation, and this is difficult because we don't have the rules yet because these laws are still so new for these things kind of being associated with our medical community. And what lack of regulation means is that we can't really say what's going in these things. So if you purchase a CBD oil, it's not necessarily known really what's going to be in there because there are no rules for it. The FDA is not involved yet. So it's really important to do your research if you are looking to purchase something like this. If your patients are talking about these things, make sure it's coming from a trustworthy, well-known company, that you research them online, see what their processes and ingredients are, and make sure you're not accidentally taking something that is quite unsafe. And another risk could be that THC causes sleep disturbances, and all CBD oil does contain trace amounts of THC. Now, with these sleep disturbances, it is all so individualized. There are going to be so many patients who say, hey, I tried this and it was great. And there will be patients who said, hey, I tried this and it wasn't. But here we have a hypnogram from an early study done years ago. It was a smaller study. It was around 500 people, but they created this hypnogram based on the average of all of those nights of sleep with the patients who smoked marijuana prior to bedtime. And they had 4 major findings. The first being that marijuana decreased the time it took for the patients to fall asleep. They very quickly fell asleep after smoking, which is great news. Then they saw that it increased slow wave sleep in the first part of the night. Those cycles were longer than they were for that normal night of sleep. But then we see that those who had smoked prior to bedtime had suppressed REM throughout the night. So that's kind of a pretty significant trade-off when we think about the slow wave sleep getting more, but REM getting less. And last, that it increased stage 2. So we saw longer and longer periods of stage 2 throughout the night. All of these things can be taken with a grain of salt. Again, it was still a pretty small study, and now a lot of our medical research dollars are being thrown towards this to ensure that people are able to learn more about it. But that being said, it really is also individualized when it comes to our patients. Now, really, again, that's our goal, is helping our patients. And when they come in and they start asking questions, I can say from personal experience in these last few years, there are a few things that do come up more often than not. The first is people always ask, is CBD better than melatonin? Unfortunately, with melatonin being that original wonder sleep drug, people kind of put it on that pedestal and like to compare other things to it. But it is very different. So when thinking about how we're answering these patient questions, how we're trying to attempt to help inform our patients more, it's really great to have a little bit of information to be able to share with them. The first I always say when somebody asks me this is that they work on different issues. A lot of times when people are taking melatonin, they consider it, this wonder sleep aid. This is the thing that's going to knock me out naturally, put me to sleep, keep me to sleep. There are these assumptions that melatonin is this natural wonder drug, but for most people, it is associated with sleep initiation. People are taking melatonin because they're having a hard time falling asleep. Now with CBD, for most people, it's not necessarily that they're having a hard time falling asleep. We're seeing that they're having a harder time staying asleep. So they do work on different issues. They can help patients in different ways, but definitely, try them out individually, experiment for the best results. When people ask, hey, I want to try this, I want to try that, how do I go about implementing this into my nighttime routine? I always say, pick a Friday night where you maybe don't have many engagements on Saturday and try it out. So, get your CBD, try it out on Friday night and see how you feel Saturday morning. Give that a nice assessment, even try again Saturday night. Now, maybe next weekend you want to see, is melatonin going to have a higher positive impact? Try it out and see which one works better. And then when we think about the time to fall asleep versus those sleep disturbances with melatonin, as we all know, that's a signal. That is our signal to fall asleep. So if our patients are asking questions about if this is better or worse, it really is about finding out at the root of the cause, what is it that you need to have addressed? Obviously, if they're in for a sleep study, that's great. That's where we need to start for the baseline. But playing with these other things based on what their actual issue is can be really helpful for patients. The next thing I always hear is, my neighbor Nancy took this and she said it was the absolute best thing. Well, that's great. It's really great when people find something they like, when they're sharing information with each other, hoping to help their neighbors or their friends or their coworkers. But it is important to share with your patients that just because it works for Nancy doesn't mean it's going to work for Barb. So our individual metabolisms really do make a difference for when we are ingesting different things and how each individual body will process it. So just make your patients aware that they should keep their expectations managed. It might not be the greatest thing for every single person. And again, experiment, try out, the different things, make sure you feel good with these things. Don't ever let your patients feel like they might have to try something or like something just because somebody else does. And last but not least is, will it get me high? Again, we learn the difference between THC and CBD. There are always going to be cases of people who say, oh, I only took CBD and I still felt like I was falling off a mountain. Maybe that body, again, with their specific metabolism, this isn't going to be a great idea for them to participate in, but just know the difference. Educate your patients and make sure that they know when they're looking at these bottles, if they're not looking to get high, not to consume a product that does have THC, and they should be hopefully just fine. Now, I know I had to shorten this class. I apologize again. The reason I wasn't able to show up in person was because of a family emergency. So I shortened this, condensed it to all the important information, but I do have the full presentation, the original one, for those of you who would be interested later. But hopefully today in our quick little session, you learned some general cannabis info. Maybe you know more about weed than you ever have before after this little blip. Some various ways that CBD can positively or negatively impact sleep for our patients. But again, our whole goal is to show up for our patients in the best way that we can to help them get the best sleep that they can possibly get. But if this conversation does come up, always encourage them to check with their primary care physician before trying things, because we don't know what they're going through medically or internally. And if it could have a negative impact, we definitely want to prevent that. But also the main takeaway hopefully would be to have these conversations with your patients in an open and judgment-free way. If they want to talk about getting high, great, talk about it. Let's see here the different things that could be impactful. It shouldn't be something that is shamed anymore, especially with all of this legalization stuff sweeping through the nation. In the next few years, it probably will be legal everywhere. So then we'll just have already had more practice with these judgment-free conversations. Last but not least, this is my information if you guys have more questions after this, but feel free to open up and ask questions now, because again, we've seen a lot of advancement here in Minnesota with this. Are there any questions? I can't hear you guys. If there are, I'm sorry.
Hey, Sarah, how about now?
There we go.
Like any other Zoom call. You're on mute. All right, here's your question. First question.
Yes, I just wondered if there was any recommendations on titration. CBD and
Yes, that's Sarah. So titrating CBD and melatonin.
I'm sorry, could you repeat that one more time?
Yep. So the question was about, are there any guidelines or recommendations on titrating CBD or melatonin?
Yeah, nope, not yet. So that's a very interesting question. That was just pushed forward as one of the conversations for the Minnesota Sleep Society, as far as how do we get this to happen? Because we don't have any rules, we don't have any guidelines. And eventually this is something that's going to be showing up in the labs like CPAP. So we're kind of just scratching the surface now. We're on the forefront, but there are no rules, no regulations, especially within the medical settings. All I can say is if they do bring it up, then start with low doses. If there's a recommended dose, which there's not even a recommended dose for taking it recreationally, let alone for sleep, and just say start small, because we don't want to see some giant impact. We don't want to see some negative impact. I personally am probably going to plan on trying it more myself just to see, so you can kind of have more to share with your patients. But yeah, we're all just winging it so far.
Any other questions? How many people Googled is marijuana legal in South Carolina, and where is the local dispensaries? Sarah, thank you for joining us.
Oh, thanks so much for having me. Sorry again for being so quick, but it really is fun and interesting. So do your research, because it can be really helpful.
Thank you. All right, so we are going to go ahead and jump to a break, which is going to put us ahead. We'll probably be able to do early today, so we'll resume in 30 minutes. So 2:45, we'll get started back, which will be the start of our next break. So we're 30 minutes ahead.